Hey everybody, Dr. Orie Quinn here at Ozark Holistic Center. And today I kind of want to ask you guys a little bit of a question of who has heard of H. pylori. It is something that commonly gets talked about, most commonly talked about. It's a bacteria. It's a bacteria infection of the stomach. And so often gets talked about in terms of ulcers, and is the causation of most ulcers. And so that's really about as far as it goes, though. People say, hey, like, you got ulcer, H. pylori. But what people don't realize is that it is one of the most common infections around in the world. In terms of the adult population, people say it's anywhere from like 50 to 80% of the adult population have an H. pylori infection. And so there's different levels of it, stages of it, and degrees of it. And the further along you go is where you start seeing it create ulcers. But it can actually create all kinds of symptoms leading up to that ulcer, including like your heartburn, acid reflux, where people get a lot of gases coming up, like burping a lot, all because it affects the way your body digests and breaks down food, particularly the protein structures of foods. And so it's something that can be tested. Here we do muscle testing assessments to try to see if someone has that kind of infection. We also have access to blood work. You can check for antigens for H. pylori to identify, and there's like stool samples that can be run to see if that is going on. It's really an important infection to look for, especially if you're having any kind of gut issues whatsoever. Because in terms of the gut, like everything matters, we call like the top down. So digestion really starts with chewing, with saliva, making sure the salivary pH is right so you can like break down your carbohydrates properly. And then you go into the stomach, making sure that the acidity level is right so it actually breaks down foods to the degree they need to be broken down in the stomach. Any kind of H. pylori infection implies that the acidity level in the stomach is not in a good spot. Because as it stays acidic, then it in itself kills off the bacteria and keeps things like H. pylori from setting into the stomach. And so it is one of those things that so many people have it. It matters like how many and how much that bacteria is grown, or whether or not you're gonna have symptoms of it. But there's ways to get that under control and to get rid of it. Maybe another note there that's important as well is it is a very communicable illness, and so it is transferred relatively easily. And so if you're working on it yourself and trying to clear it, get rid of it, and it's not going away, then we do need to look at those that are like in your environment and who you're around, because you might have to work on it multiple people at one time in order to actually get it out of view, but then also out of your environment. So, and there's a lot that can be more said there because it can affect so many different systems. H. pylori gets worse, and you eventually end up, it can get as far as getting into the blood, which becomes a very, very inflammatory mechanism for the blood, which is not good. You can actually pick up on that with like HCRP levels in the blood and checking for that. And that is something you gotta make sure like does not happen, because in terms of cardiovascular health, no good. But like I said, so if you had any kind of gut issues going on, especially food sensitivities is a common place where we'll see this, but even just like bloating, lack of digestion, like feeling there's just big issue there, H. pylori is absolutely something you want to look for. Thanks, guys.